So I'm Dr. Ron Hunninghake, and I've been here for about 33 years. I'm a native Kansan. We've got a Puerto Rican here. He's not from Puerto Rico, but Dr. Thomas Levy is a long-term friend of the Riordan Clinic, and many of you may have heard of him because he's the author of 13 books. He's well known in the nutritional world, and he just happened to be here this week, so we weren't planning for having him here, but this is kind of a guest bonus for us because we're going to be talking about nutrients, and I can't think of anyone who I'd rather have on the stage with me than Dr. Thomas Levy. So the other thing that's maybe a little bit different today, it's not so much a lecture as it is a presentation. We had some slides, but we're trying to make it a little bit more interactive so that you can be a participant in this discussion about how we use nutrients to optimize our health. And so just by way of introduction before we jump in, Dr. Hugh Riordan, who is the founder of the Riordan Clinic, many of you have heard of real estate agents will tell you that the three major things about a house is your location, and your location. Well, Riordan's idea was the three most important things about your health is measure, measure, measure. So the theme of today is the power of measurement and how that can help you learn where you are, what your strengths are, and maybe where the gaps in your nutrient team are. So this is really one of the questions that he always asks is, what is the most important nutrient? Have you all thought about what's the most important nutrient? It's a trick question. It's the one you're lowest in. Normally that's because that's what's going to pull down the team. But there are super nutrients as well. And so, Dr. Tom, what do you have to say about the side of super nutrients?
Well, probably super nutrients would be those nutrients that if you're depleted of them, you have a clear consequence, such as a deficiency syndrome. So not enough vitamin C, you have scurvy. Not enough vitamin B3, niacin, you have pellagra. Not enough thiamine, you have a heart condition called beriberi. Other things are certainly important to your health, but if you don't feature them in your diet or feature them in your supplementation, they might play a role in you just generally feeling poorly, but they're not going to give you a definable disease. So those are your, shall we say, most important nutrients because of those disease states that you could get. And also because, generally speaking, they're macronutrients. They're nutrients you need a lot of. Now, some nutrients you don't need that much of because they recycle, okay? Iron and copper, which I never advise supplementing, never, because they recycle, you excrete very little, and if you take in any extra, it always results in a toxic accumulation. Another mega nutrient, but not one that I recommend, mega nutrient only in the sense that there's a lot of it in your body, but you don't want a lot of it in your diet, is calcium, okay? It's excess calcium that is the single feature. Excess calcium is the single feature of a disease cell. The higher the cellular level of calcium is, the sicker the cell until it becomes malignant, until it dies. And the one thing, now here is where your super mega nutrient comes in, that's important for that is magnesium. You'll never get a normal calcium until you get a normal magnesium. And don't worry about taking too much magnesium. We have so many toxins knocking our magnesium down. You'll never overdo it unless you take extraordinary amounts IV. But if you take extraordinary amounts orally, you'll sort of get that same loose stool signal that you get when you start taking large amounts of vitamin C.
Most of us have, probably the reason you're here, if you've learned how important nutrition is in your life and you value your health, and you know that maintaining adequate nutrition is a foundation of longevity. But to try to answer the question, am I getting enough? We live in a world where we have all kinds of meters. Our fuel tank meter tells us when we're getting low. By the way, how many have run out of gas in the last year? Used to be that there was 3 or 4 hands that went. No one runs out of gas now because the car starts beeping at us and things start going off to tell us we need to go get gas. That's not completely true. I think what happens in humans when we run out of one of the important nutrients, we start to get symptoms. The problem is we don't always know what symptom corresponds to which nutrient or group of nutrients that's deficient. But certainly we all have ways of maintaining the levels of things that we know are important to us. Let's say our checking account. And I'm sure most of you have a way to check that often, and you probably do. But when it comes to checking nutrients, that is something that is not generally thought of as important by conventional medicine, and the availability of it is slim. And so years ago, when we started the Check Your Health program, the idea is to make nutrient testing available on a more affordable basis. And we give you a whole palette of nutrients that you can look at. And this is where answering that question, what's the most important nutrient, the one you're lowest in, how would you ever know which one is affecting you? And symptoms don't always tell the story. There are some nutrients that if you're low in it, if you're low in vitamin C, you're going to get scurvy and you'll have certain symptoms. But symptoms are not necessarily specific for the different nutrients. And so this is why it is beneficial to go through and kind of a checklist of what your body needs in terms of from these different areas. And so
also in general, we're talking about deficiencies here, which is the case most of the time. But there are some nutrients outside of calcium, copper, and iron, definitely in the minerals, where you could be having problems because you have an excess. So that's just as important then to identify significant minerals that you have an excess, like too much selenium, too much of these other things. They have clear toxicities, and some people, and this is reasonable with most nutrients, but not all of them, some people just completely think that, well, I have this supplement that I like and I feel good, and if a little is good, more is better. Usually that's a good assumption to make, but because of the fact that there are unique supplemental nutrients that if you supplement them wrong, you can go too high. So proper testing lets you clearly know when you're in the right.
Okay, so these are the ones that are probably the most important for you, that are going to give you the greatest bang for the buck. And so I'll let Dr. Tom kind of go through this list of the first 4, because if you're not aware of these, you're missing an important part of what you can do to take better care of yourself.
This actually represents an evolution of personal and patient responses to nutrient supplementation over many years, but I've only put it all together the last year or so. And I got to say, now mind you, I don't sell a supplement package. I'm not making any money off the sale of supplements like this. I'm just telling you what I have found to give you the best bang for your buck, because I don't know of anybody that's not concerned about their economy and what they can afford. So let me start by saying, because everybody says, well, what about this? What about this? What about this? Well, there's literally thousands of supplements out there, and most of them are good for you. Obviously, you can't take them all. Obviously, you can't afford them all. So I present this in the context of, this is what I consider to be your essential baseline. I mean, if you have 2 or 3 or 4 other things that you've been taking and you like them and they make you feel good, I'm not saying don't take them. I'm just saying each one of these things has a specific role in getting you healthy and keeping you healthy. And in the past year, I get emails all the time. What do I do? And I say, well, I can't give a specific advice, but in the meantime, try this supplement regimen, and the feedback is quite incredible. Now, the first 4 are what did I just mention earlier, how toxic calcium is inside your cells. I wrote the book called Death by Calcium, and it's not an exaggeration. And then a book later on called Magnesium, Reversing Disease, because it's the actual antithesis of calcium in your body. So the 4 things that really strongly impact and help to normalize and keep normal calcium levels inside your cell, which is the single most critical measurement there is do I have my calcium normal enough? Because at that point in time, you can take in more vitamin C, you can make more glutathione, you can make everything so much more normal, but none of it happens as long as the calcium is up, causing excess oxidative stress. And so, of course, our vitamin C is profoundly important there. And the dosages are not etched in stone, but generally the more the better, okay? Magnesium chloride. Now, there's over a dozen different types of chloride of magnesium out there. And they're all good. They all provide magnesium. Some are more expensive, some are less expensive. Why do I say magnesium chloride? Well, in the context of the pandemic, which, hey, we're still in. I mean, there's still a lot of people with chronic COVID and a lot of people getting brand new COVID. So it hasn't disappeared. Magnesium chloride is an especially potent antiviral form of magnesium. In some experiments that they did, magnesium sulfate, which is commonly used in IVs, they found that magnesium sulfate in cultures of viruses increased virus growth and magnesium chloride decreased virus growth. So magnesium chloride is very inexpensive, and that's why I recommend that specific one. But if you have a magnesium glycinate that you like, or magnesium threonate, that's fine. Vitamin D3, you have a dosage range there, but the whole idea is get yourself to a blood level, and it doesn't have to be done frequently. I mean, start on a dose, check the blood level several months later, and if you're where you want to be, you'll pretty much stay stable like that indefinitely. So it's not something you need to compulsively check and recheck and recheck. But you want to get yourself to a dosage, to a level between 50 and 100 nanogram per cc, 50 to 100. And then vitamin K2, extremely important in dissolving old calcium deposits and working optimally with vitamin D. And I might add, the other reason why you don't supplement calcium is because when you eat a balanced diet and you have a normal blood level as defined over what I just told you, 50 to 100, a normal blood level of D3, you'll take in the amount of calcium that you need. Okay, so we all love dairy products, but we can live without them. And calcium supplements you can live without absolutely completely. And for those ladies on supplementing calcium and osteoporosis, all I can tell you is look at the book. If you send me an email, I'll give you a free ebook. I'm not here to make money on you. So just send me your email. I'll send you the book, Death by Calcium, and it'll outline not only what you shouldn't do, but what you can do to strengthen your bones. Now, here's the second 4. So the first 4 was anti-calcium, decrease intracellular oxidative stress, and increase intracellular vitamin C. Because let me tell you, when you have normal levels of vitamin C inside the cell, you've got a normal cell. And the other thing that bolsters that, you have 2 main goals, in my opinion, for a healthy cell. One is vitamin C levels need to be normal. And number 2, ATP production inside the mitochondria needs to be optimal. ATP, if you've never heard of it before, is the most powerful energy-providing molecule in your body. And it powers many, many different enzymes inside you. And when your ATP levels drop down because your mitochondria are not making enough, it's all the different problems you have, fatigue, etc., the whole ball of wax. So why do these 4 supplements matter for that? Well, briefly, inside the mitochondria, which you may or may not have heard of, is considered the energy generating part of your cells. Okay. Well, when you take in food as it stands right now, and you have your glucose sources in general, I'm glossing over a lot of stuff here, your glucose starts the Krebs cycle, and the Krebs cycle goes through a bunch of reactions so that you eventually donate electrons to a final common pathway called the electron transport chain inside the mitochondria. It goes from something called NAD, nicotinamide adenine dinucleotide, to FAD, which is flavin adenine dinucleotide, to coenzyme Q10, to something called, cytochrome oxidase B, excuse me. Now, and then after that, the electron, by wonderful biochemical magic, goes into something called ATP synthase, and you start churning out large amounts of ATP. And why is all that detail important? Because if any chemical reaction where you're going to go from point A to point B, or maybe more accurately from point A to point E, we need B, C, D optimally supported with optimal amounts of substrate. In other words, a chemical reaction is not going to go anywhere if you use up everything you're trying to convert to something else. So you need to keep on supplying those parts. So what do these supplements do? The niacinamide, which is the non-flush form of vitamin D3, it's perfectly fine to take niacin. I don't. I have horrible flush reactions, but if some people say they take it without any problem, then that's fine, because niacin probably does just a little bit more than niacinamide. But if you have any flush problems, you stay with the niacinamide. 1,000 to 3,000 milligrams daily. Dr. Abel Hoffer, many years ago, in the 60s or 70s, the orthomolecular psychiatry, would routinely cure most cases in advanced schizophrenia with 3,000 milligrams of niacinamide a day, along with some vitamin C. And we have articles written on all of this, but I'm just telling you, this is not just pie in the sky.
Yeah, the foundation of all this is a whole foods diet where you're going to, and lots of colorful fruits, vegetables, and you're going to be picking up nutrients there. These are fundamentals in terms of maintaining energy, but what about the rest of the nutrients? And this is where, here at the Riordan Clinic, what we have done over the years is provide people an opportunity to determine where the gaps are in their nutrient team. Obviously, the Super 8 is a foundation set of nutrients that would be good for everyone. But oftentimes you can use the lab here to find out where you might be especially low. Like, for instance, I don't know if my thing's going to work here. Yeah, so folic acid, this person has a fairly low level. Now, they're not out of gas. Once again, the fuel gauge analogy, they're not out of gas, but they should be looking for a filling station, right? And so don't wait until you're completely low. But folic acid is an important part of homocysteine functioning. And so this methylation pathway is a huge part of how the brain functions, our mood, our ability to make neurotransmitters. And so if this were to be low, this would be an area that particular patient could make use of in terms of helping their chronic situation.
And generally, with this type of testing or any other type of lab testing, it's important to realize that if you feel sick, you had abnormal blood work. We'll find lots of abnormal blood work. But if you feel perfectly fine, you may have early abnormalities in your blood. So basically, lab has a value once it's abnormal, showing by improvement that you're doing the right thing. But just as importantly as when you feel well, are there clearly defined abnormalities just waiting to flourish if I don't pay attention with the right type of nutrition and supplementation?
Nutrition is basically a team sport, and you want to make sure all the different players are playing their position well in order to get the best outcome of your game. You can also use, like, for example, these beta-carotene, lutein, and lycopene phytonutrients. Colorful phytonutrients are incredibly important for our health. And not that you have to measure all of them, but if you measure these three, you have a pretty good idea if you're getting enough of the good quality fruits and vegetables. There's a book called The Color Code, where the authors, used to be 5 colors a day is great, but if you want to be really healthy, 9 to 10 colors a day would be best. But this is another way of determining if you're absorbing them and utilizing them properly. Vitamin B12, this particular chart shows that the individual, by the way, this is Peter Pan that we're showing today. Just as something that we use as an example. But the B12 is a very important B vitamin that we assume if we're eating lots of meat, red meat especially, we're going to get plenty of B12. I can't tell you, maybe 30-40% of the patients that I see that we go over will come in with low B12 levels. They're eating food that contains B12. What goes? Well, there's a factor in your stomach called intrinsic factor. And if you're not making intrinsic factor, you're not absorbing your B12. So just having a diet that is high in B12 doesn't guarantee the fact that you're going to get enough B12 in your body. And then if you don't, low B12, folic acid, all of those things can really set you up for a number of symptoms. And a lot of the patients we see, fatigue is the number one symptom, but along with it, sleep disorder, dry skin, or bowel problems. Every cell in your body requires a full team of nutrients in order to function optimally. And so when we start seeing panels, and so the way we've divided our test results into is panels. And so the second panel that's most common is the B vitamins. And once again, these have to do with methylation, and methylation has to do with your immune system. Your body cannot make glutathione if you're low in vitamin B6, but B2 is a very important methylation vitamin. Dr. Ludes talked about niacin. The nicotinic acid and the niacinamide can be markers for this. And then B5 has a lot to do with your adrenal functioning as well. So these are examples of how your body requires these things, but as a checkup, as a way to avoid the harm before it occurs, get your nutrient levels checked to make sure you maintain a high level so you don't basically get into a deficiency state.
Whole seeds, different seeds. And I said, well, that seems like a good way to get everything I need. And I did my first NutriBullet after having been depressed for years. And then within an hour, my depression lifted and never came back. The point being is, if you're deficient in something that's not in your regular diet, it's never going to be repleted. Okay, so you're not just going to stumble across, well, I did in this case, stumble across it, but just by eating, you could be on a perfect organic diet and everything else, but if you had encountered in the past, for example, a severe infection, maybe even a low-grade encephalitis, this, that, or the other, and you chewed up a lot of your nutrients in your brain and you recover, well, your brain's not going to be normal again until you bring those nutrient levels back. And that's why you get as diverse an array of quality food and try to document, if testing, what you're truly deficient in. But just remember, you can eat a wonderful diet, but if you're deficient in something relatively obscure and never address that, you never get it back. For example, toxic in copper. Notice that the top of the bar, it's red. It's green if you're getting enough, but if you're getting too much, it's not good for you. Same thing for manganese. So nutrients are important, but excessive nutrients in certain cases can be a real problem. Most people you're not thinking about selenium. You're not thinking about magnesium, or maybe you're thinking about magnesium now because Dr. Lee's pointed out how incredibly important magnesium is. But I know from the case of my father, who basically was having chest pain, and he took Tums all the time. So he was getting too much calcium, and he ended up having chest pain. Went in, did a cardiac cath, turned out that was clear, but what it was is that he was low in magnesium because the doctor, in this case, a cardiologist, had done a magnesium level that was very low.
put him on magnesium chloride, and for the rest of his life, his extra heartbeats went away, his indigestion went away, and he was able to quit smoking. So just by finding out a key fact like that, it can have a dramatic change in your health history.
Let me just say, this is a big thing to throw on you, just as an aside, but I'll do it anyway, is the research that I've done on magnesium. I'm going to tell you now that new onset arrhythmias, atrial fibrillation, extra atrial beats, extraventricular beats, unless you have an underlying congenital heart defect. So let's start with you're born with a normal heart. You're born with a normal heart, you will never get an extra beat in an arrhythmia if your intracellular levels of magnesium are normal. And this is especially important now because we have so many people with persistent spike protein, maybe even a low-grade myocarditis that they don't know about. Well, the only thing that's going to kill them quickly is the sudden arrhythmia. And I'm telling you, the sudden arrhythmia will never occur if you have those magnesium levels up. And believe it or not, there's a lot of literature to support this, but I've never seen it put together this type of package. I mean, I'm a cardiologist, and in my previous lifetime, I gave all the anti-arrhythmic drugs, and I gave all the Holter monitors, and I traced it now. But you can now see if you have somebody with an abnormal Holter monitor, and you hit them with a ton of magnesium, those beats just start disappearing. It's very analogous, if you will, to an unstable neuron as to an unstable heart cell. An unstable neuron has a poor electrical imbalance which can precipitate a seizure. An unstable myocardial cell can precipitate an abnormal extra beat. And in both of those circumstances, the magnesium makes it normal. But if it doesn't work, it's because we didn't push hard enough. That's something we can talk about another day.
So the next set of tests, and this makes the point that the amino acids are the building blocks of your proteins in the body. And you'll notice up here, we've got two sets that some of them are, they're capitalized at the beginning, but some of them are, all the letters are capitalized. And those are the essential amino acids. So from the 8, and some people say 10 essential amino acids, your body can make the other 12 non-essential amino acids. They're essential, but they have to be there in the right ratio. Well, that was what we determined, that the essential, the capitalized ones, if they're in the right ratio, your body is more likely able to make the proteins that it needs, especially the enzymes. And the area that I kind of found out about recently is that if you do not have the right ratio of the amino acids in your gut, you cannot make the enzymes that you need to repair leaky gut. A lot of people go around with chronic food allergies, chronic irritable bowel, a lot of problems involving the gut. And the gut is such an important place. The microbiome, you've heard about how important that is. But it's the enzymes in the digestive system that repair the lining of the gut. And if you don't have the right ratio of the essential amino acids, you can't make the non-essential ones in order to have a full team of nutrients to create the enzymes which will do the repair there in your gut, let alone all the functions that the enzymes do throughout the body. Because without the over thousands of different enzymes, we couldn't function biologically. Any comments on?
Well, and just remember, amino acids are what makes your proteins. Protein. And there's nothing that goes on in your body that's not affected by or regulated by different proteins. All the enzymes are proteins. So these are really the essential building blocks. And it's kind of like you can still build a house with all the foundations missing, but when the wind blows, the wall might fall down.
But if you're especially low, now this particular individual has pretty good levels, but if you have several, 2 or 3, 4 levels that are in the red, that's pulling the whole team down. This team concept is crucial in nutrition. It's not just you can take one super nutrient and do it all. You've got to have all the factors there in order to get what you need. And that's why having a good, looking at your plate and seeing all kinds of colors, colorful foods tend to and designate whole foods. And if you have whole foods, you have more of the whole team of nutrients that helps you function better. So this panel also, this is the mega panel that's offered here today, and along with 4 other panels, but the mega panel also has your thyroid functioning. And so I can't tell you how important that is. If your thyroid is off, you may end up with chronic fatigue. You may end up with headaches. I literally have a list with about 24 different symptoms that can occur if your thyroid's not functioning properly. We also do a more comprehensive level. We include the reverse T3, which in this case is normal, but you can have normal TSH, which is what most people get done by their doctors. You can have a normal T4. You might even have a normal T3, but if you're under a lot of stress, if you're inflamed, if you're toxic, this reverse T3 will shoot up, and the reverse T3 will adversely affect the ability of the cells to use T3. So you can have a functional hypothyroidism even if you have normal TSH and T4. So this is one area that you can do more than what you would normally get from the standard evaluation.
Hormones, you probably all realize in general, are very important. But the 3 most important hormones tend to be chronically ignored, yet they have the most enormous impact on health, especially as you get older. Number 1 is the sex hormones, whether it's going to be estrogen or testosterone. Number 2 is thyroid hormone, bearing in mind that the most common form of thyroid insufficiency, which is a subclinical thyroid insufficiency, is not reflected on your quote-unquote regular thyroid tests that you get at your doctor's, but is only reflected when you take this somewhat more esoteric look at reverse T3. So, and the last one is cortisol, that your adrenal glands naturally make. Now, when you're deficient in any of those, and believe it or not, probably most of us past the age of 60 are deficient in all 3. Maybe not massively deficient. And then you start looking at synergistic effects. You're a little, think about cortisol. Cortisol, for example, we've talked about how important vitamin C is. Well, guess what the most important role of cortisol is? To push vitamin C inside your cell. That's what makes steroids so powerfully important, is because until you run out of extracellular vitamin C, and you have some area that's inflamed, and you take some of these ridiculous, powerful, I never recommend them, prednisone, etc. You push the vitamin C to take your body inside the cell, and man, you feel great for a while. But then you continue to take it while not taking more vitamin C, and then all you start to do is get the side effects of those powerful steroids. And all of these things, the sex hormones and the thyroid hormone, the lower they are, the greater your all-cause mortality. So, I mean, they're clearly made to, the lower they go, the sooner you die of any condition. These are modulators of oxidative stress in every cell in your body. So again, that's why you look at the Super 8, because they affect all the cells in the body. And in this particular case, it takes. And there's different things we talk about that cause these things, but for the most part, you first need to find out what your status is. Again, back to the important role of testing.
Yeah, I think where hormones kind of got a bad name is a lot of them were synthetic. They were not identical, bioidentical to what's in the body. And even these would do some good, but after a while, if you didn't have the supportive nutrients, they stop working, and people will be on their hormones and they're saying, just, it's not helping anymore. What's going on here? You need the nutrient cofactors to support them. The other factor here is that when we use hormones, we use bioidentical hormones, and we measure them frequently, because it's when hormones get out of normal balance that they can cause problems. And if you're lacking key support nutrients, you may not get the results that you need. And a lot of the medications that are synthetic hormones, they do some good, but the longer you take them, the more likely you are to have side effects because you really can't fool Mother Nature. Mother Nature says, hey, we've got to have the whole team of nutrients there for this to really work properly. So these are factors that where you can do more of your own self-care. To me, the true health care is self-care. Now, obviously, we need doctors, we need the medical profession, we need people who know and are professionals. But ultimately, your own personal choices are the most important part of your health. And being aware and knowledgeable and more knowledge-driven is, I think, the best way to maintain good health.
And you know, this is a hypothetical example because this is Peter Pan. And I don't think Peter Pan could ever have that high a testosterone level.
Okay, had to put that in there. Okay, let's go to the next slide here. This is a really fascinating area, the fatty acids, omega fatty acids. I'm sure most of you have heard about omega-3 and the importance of fish oil, EPA, and DHA. They are very important in terms of your brain. They're very important in terms of inflammation modulation, your skin. They're crucial. Gamma-linolenic acid, a lot of people don't know about that, but that's an omega-6 that can be very helpful with chronic inflammation, especially in women. And then what we do that's kind of helpful, we do this arachidonic to EPA ratio. Arachidonic is if you're getting too many of the bad fats and not enough of the omega-3, it'll show up very dramatically in this particular ratio here. And so I'm constantly encouraging people to eat more fish or to think about using omega fats as a way of modulating inflammation. And then there are a number of other monosaturated fats that are very beneficial. Maybe you've heard about the seed oils. And if you're getting too many of soybean oil, canola oil, corn oil, these are the oils that will turn into the trans fats. Monosaturated fats, though, are very safe. Olive oil and avocado oil, butter, coconut oil. These turn out to be very safe and non-inflammatory oils. And so they can have a big impact upon helping regulate your cholesterol as well. So once you start looking at nutrition, remember we are incredibly made. You know, the human body, it's just unfathomable how life is able to occur, but we do have to provide the nutrition. So that somehow it's been missed in the conventional thinking that, in my thinking, now that I've been here 34 years, is that your nutrition and the way you maintain your levels can help you maintain your overall health and well-being and reduce your risk of chronic illness, especially as the aging process goes forward. So here's the cholesterol panel, and I'm curious to ask Dr. Levy. I have a lot of patients that are wondering what are considered the normal levels, because nowadays, if you look cross-eyed at a doctor, you will get put on a statin. And so what is the story about that in terms of the overutilization? I feel like it's an overutilization of statins because they are not without side effects.
Yeah, the only time in my scientific and cardiological opinion that a statin does you good is when your cholesterol is not minimally elevated, but massively elevated. I'm talking like over 300, this sort of thing. Then bringing it back into the mid 200s has a clear benefit in reducing heart attack, even though it's ignoring a whole bunch of things that you shouldn't be ignoring, which is, why is the cholesterol elevated? Cholesterol is a natural antitoxin. So it's your body's defense mechanism to protect your body, in this case your heart and the coronary arteries, from the toxins circulating in your blood that are usually coming from the mouth, infected teeth, infected gums. So when you just take a statin then, and you go look at the rest of the body and you go get rid of the toxins, what are you doing? You're leaving the toxins up and dropping the protection. So at that point in time, and there's a lot of literature on this, the lower your cholesterol goes in the face of not addressing your toxins, the greater your chance of cancer. Go down, go up. Okay, so another important point to realize is they treat cholesterol like it's the cause of atherosclerosis. It's not the cause. The only thing that causes atherosclerosis is a total depletion of the vitamin C in the blood vessel that comes from chronic pathogen colonization from your mouth. Okay? And the thing is once atherosclerosis has started, cholesterol can accelerate its development. But cholesterol by itself, if you have these normal levels elsewhere, will never cause atherosclerosis. So and right now, they're really going crazy. They're prescribing people down to 150, 125, 100. The infamous vegetarian Nathaniel Pritikin. Is Pritikin diet? You might have heard of it. Well, Pritikin had a phobia about getting heart disease. And he was sold on the high cholesterol, high heart disease. So I think he started with a cholesterol of like 350, something along those lines, and vigorously and viciously dieted and brought his cholesterol down, finally, amazingly, to a level of 100. But the rest of the story is he then got leukemia and died. Okay, so try to figure out why your body is doing what it's doing. All right, if you have this extremely elevated cholesterol, there's a reason for it. It is virtually always unaddressed focal infections with the expression of toxins. You talked about calcium and oxidative stress. The only thing that causes excess oxidation is excess toxins. You can't have excess oxidation without excess toxins or depleted antioxidants. The plague that's really hitting our planet now is what's called the metabolic syndrome, where people are gaining weight, high blood pressure, high cholesterol, but also very high triglycerides and blood sugar. And what I see a lot of is people will come in with elevated triglycerides, probably too much sugar, and a low HDL. And so that ratio of triglycerides to HDL is very helpful, because if you can lower that down, even if your LDL is elevated, if you have a ratio of less than 1.7 to 1, you're okay. You're not at risk. And so very often I can help people really understand what their lipid panel is, besides just as a doorway of taking more statins. So this particular individual has a triglyceride to HDL ratio of 4. So basically, by just reducing sugar and other high glycemic foods, that alone will help. And then, of course, doing more exercise, normalizing the other nutrients, eating whole foods, these types of things, they'll go together. Avoiding the seed oils, all that can help. So now we did, the other part of this testing was we do a standard blood count. Most people are not, they mostly think in terms of, is this just a measurement for anemia? Yes, it is. But these numbers here can tell us whether or not you might be deficient in iron, or, and we have a video to show you here in just a few minutes about iron that'll knock your socks off. And then this is if you get high indices, these are called the indices, that can be an indication that you're lacking in either B12 or folate. And once again, back to the intrinsic factor issue. We do a UA. We also check the vitamin C level in the urine. This is a chemistry panel. I'm sure most of you are familiar with that. I think I'm going to go ahead and I think this pretty much is the rest of it right now. Oh, let's do the last list here. So we actually do measure a glutathione. And so glutathione is the most important antioxidant that your body can make itself if you have adequate methylation, the B vitamins. The homocysteine can also be very level. This is the H factor that I did a luncheon lecture on, and it can be a predictor not only of heart disease, but also of Alzheimer's and other chronic illnesses. The ferritin is really important in terms of a marker
not only of iron, but of inflammation within your body. And then C-reactive protein, very important because we all can have low-grade inflammation and not know it. And the C-reactive protein will tell us if there's a hidden inflammatory factor in your body going on.
We're going to look at an enriched cereal that says it has 100% of the daily requirements of vitamins and minerals, and demonstrate through magnetism that the form of iron inside this cereal is actually metallic filings. It should be clear then that this is not really a bioavailable form of iron, and in fact may well represent a toxic form of iron. Extrapolate this to all the other enriched foods, and then you can see that you might be getting a number of, quote, nutrients, unquote, that you might not want to take in on a daily basis. Okay, we have here a box of cereal that supposedly has 100% of the mineral and daily requirements of vitamins and minerals, including, of course, iron. So let's go ahead and open it up. We have our flakes. Let's see. Okay. Now we're going to take a few flakes out. Put them on top of the water. And I'll be able to show with this strong magnet that there's enough metallic iron in here to steer this flake around the water. And if you think this isn't unusual, take a magnet and float anything else on water. The magnet will have no effect on it. Okay, having done that, we're going to go ahead and take this bowl of water, put it out of the way. Our next step, I'm now going to show you a demonstration in which we're actually going to pull these metallic iron filings out of the cereal, and you'll be able to see them very dramatically. We have a baggie here, regular ordinary baggie, and we have taped to the side of the baggie another one of these magnets, just like this one here, so that when we put together cornflakes and water, and they're all mixed and crunched up together, and we slosh it all around, you will eventually see black iron filings collect on top of this magnet. What we'll do first is we'll put the cornflakes or the wheat flakes, as the case may be, in a mixer with water and puree it fine so that all the iron filings that are contained in there can be easily pulled out of the solution by the magnet. Wait the box out of the way. We'll try to use most of the flakes so that we can get a maximum concentration of iron for you to see.
Right, get pure distilled water, it won't matter.
Okay, we're now going to transfer the cereal dissolved in the water into the bag. We might put a little bit more water in to make it a little more fluid. And then we're going to slosh it around so that as much of the volume of this passes across the top of this magnet, and you'll see that these iron metallic filings will then gather.
There's lots of toxic effects and odds. There's nothing more toxic than iron above the bleach.
Try to be delicate and not too messy. Okay, we slosh this around. Our magnet is right here. It's the same as this magnet. We see this green. Here's the green side of this magnet. And you see this enormous amount of metallic filings here. After this, I'm going to cut this out of the bag, and you'll be able to see these filings in even greater detail after I dry them. Now I'm going to take an empty bowl and put this in here so that we don't make an enormous mess. But I just take my scissors and cut this area out so we can look at these iron filings in a little greater detail. Okay, now I'm going to put a little water on this. Now, the next thing I'm going to do is I'm going to take a hair dryer and dry these out completely and then pull the magnet off and drop them on a sheet of paper so we can see them in the final detail. Okay. Take the magnet away. Okay, now we have the filings on the paper. I'm going to take a magnet underneath the table and see how the filings stand up. We push them over from one side to the other. These are clearly metallic filings attracted by magnetism. By deduction, they're iron. So that concludes our demonstration. I think you'll agree this is a pretty dramatic demonstration that you can pull with magnetism metallic iron filings out of supposedly enriched cereal. Are metallic iron filings something you want to eat, either in cereal or in pastas or in other flours or other enriched foods? I don't think so. So, buyer beware. Or maybe buyer be aware. Bon appetit.
Question about what nutrients would you say are beneficial for dementia and Alzheimer's?
Well, the big A with a strong focus on the 4 that increase ATP in the brain, because that's what Dr. Hoffer did quite a few years ago with schizophrenia. And really, all neurological syndromes are variations on the same thing. It just depends on where are the pro-oxidant toxins located, where are they concentrated, where do they come from. It's only the distribution of where your pro-oxidation causing substances, also known as toxins, that determine the disease. And that's why there's a crossover here. You have the clear neurological physical, and you have the psychiatric, the mental, and the emotional. Well, we're dealing with the brain, so actual derangements of nutritional balance in the brain cause a whole ball of wax. And many people, I showed you the methylene blue, that I told you how quickly it picks up ATP production inside the brain. Many people see profound changes in what they consider to be their depression after their first dose. Okay. So,
Question about taking vitamin D3 with K2 if they're on Eliquiz. I mean, is K2, K1 is a coagulation vitamin, but K2 is not. Have you heard of any problems with that? Taking vitamin D3?
Well, I've not heard of any problem. I wouldn't advise you to do anything the doctor tells you not to, but you can certainly do an extra coagulation test down the road to make sure that that's not being affected in that fashion, but I don't think it would be.
Yeah, so K2 comes in MK4 and MK7. Both of those are directed towards getting calcium into your bones, not into your tissues. The MK4 has been emphasized more for people that have osteoporosis, and there's some products that emphasize that. MK7 typically is when you get a D3 K2, it'll be K2 MK7. And that prevents, everyone's concerned that, well, a lot of doctors are concerned that too much vitamin D is going to give you too much calcium into your tissues. But if you're taking it with MK7, that extra calcium that's absorbed will be put into your bones and teeth.
In regards to excess D3, that's really astronomical levels. I mean, in the past, they would give 500,000 units at a time, this, that, or the other. And next thing they know, they started seeing people develop decalcification. So it's not a real concern if you're anywhere close to the recommended supplementations and the recommended blood levels.
I've got a question. This could be a whole nother lecture, because can you give they're wanting to know why is the dental implant, is it just as toxic as a root canal?
Not even close. A properly done dental implant is perfectly fine. Okay. 100% of root canals are chronically infected. 100%. All right. Some have worse impact than others because they leak more toxins than others, but the inside of the tooth, the root canal tooth, has the pulp replaced with pus. Okay, it's that simple. And then the root canal procedure takes the pus out, but it also takes away any chance the tooth had of healing, because the only thing that's going to make you heal is the connective tissue, the nerves, and the blood supply inside the tooth. So 100% of root canals are toxic, and some people do better than others, but remember, all disease is not just toxicity, it's cumulative toxicity. So you have this, and you have other things going on. What's your magic amount of toxicity to cause X, Y, or Z disease? Who knows? But I can tell you as an aside, and there's another article I wrote on this. The title of the article is Root Canals Cause, not health, root canals cause breast cancer frequently. Okay? Every root canal, every infected tooth shares a lymphatic drainage with the breast. So every time you chew on this infected tooth, you squeeze pus and infected lymph directly down into the breast tissue, and you do see this on thermography. So you, family, friends, or whatever, for God's sake, don't go straight to the oncologist or whatever if you have a lump in your breast. I mean, at the very least, get some non-invasive testing and training, thermography, etc., and somebody that can properly read it, and a biological dentist. And we have a couple in town here that know how to look for occult infected teeth. Now, because there's a lot of other infected teeth aside from root canals.
That's why everybody gets. What are the best nutrients for chronic active Epstein-Barr, in your opinion?
We gotta go back to my Super 8. Absolutely. Okay. And you would push harder on the things like vitamin C, magnesium, and methylene blue. Those are all powerful synergistic agents for holding infections at bay and even knocking them out.
And then if you did the testing, you would also be able to fill in the other gaps, low nutrients, because the more nutrients that are working for you, the more powerful the synergism of these various nutrients. What is the role of stomach acid, and does it affect nutrients in terms of absorption and changing them in terms of how the body uses them? I guess is what this question means. I think stomach acid is a good thing, and what it's meant to do is protect the rest of the gut from bacteria and viruses. So actually, we need stomach acid. I don't think it's going to hurt your nutrient vitamins more often than not. They'll make it through fine. So the big thing is not thinking that acid is a bad thing. My biggest concern about the acid blockers is that they also block mitochondria. So if you're on an acid blocker, then you really need the Super 8, because the Super 8 are all about mitochondria. And the whole big thrust in modern health physiology is maintaining healthy mitochondria, especially your brain. We did a talk on mitochondria in the brain, and at that talk I said there was 100,000 mitochondria estimated per neuron in your brain. I was wrong. I just read an article where they say there's 1 million mitochondria in each neuron of your brain, because if you think of all the electrical activity going on in your brain, so for taking good care of your brain, you especially need to have the full team and the A team in terms of the Super 8. Probably the worst thing that Prilosec, taken on a regular basis, does to you is it depletes your magnesium even further. So we're already trying to get magnesium up, and that's countered on a daily basis. I mean, Dr. Mercola had an article not too long ago that talked about 70% of Prilosec users having problems with migraine headaches. Well, migraine headache is a straightforward magnesium deficiency disease. Okay. And just like high blood pressure, all of the magnesium deficiency. So just remember that, if you're
because the magnesium is so important. So just keep that in mind. If you can do without them all the time, great. I know some people don't. They have nasty stomachs and they need them. But one thing that that they offer at the clinic here too, a company that I've worked with for a long time, because it is difficult. And I had a problem with, I had atrial fibrillation about a year ago. It's gone now. With a completely normal, no extra beats, because I jacked up my mean magnesium hit really high. I don't think I could have jacked it up high enough with the traditional magnesium supplements, because you start to get bowel intolerance, etc. And so I went to the liposome encapsulated magnesium that Riordan Labs mix. They've got a lot of fraud in the liposome industry. And I'm not making a general recommendation for some liposome product you saw, because everybody and their brother imitated Riordan Labs 18 to 20 years ago when they started making their products. And they just call anything liposomes to try to jump on that bandwagon. But 3 packets of this a day has kept me solid as a rock for a year. And generally, once you start getting atrial fibrillation, it's just a downhill battle. It's one of the primary reasons I told you. In my opinion, no doubt about it, it's impossible to have an extra beat come from your heart that's not congenitally damaged if the magnesium levels are completely normal inside the mitochondria.
Is diabetes caused by bacteria? I'm thinking they're thinking type 1 diabetes caused by bacteria in the pancreas, especially in young children. Is diabetes type 1 caused by bacteria in the pancreas? Or is that a toxic reaction with the beta cells?
I don't know. But I tell you what, we know that low-grade infections are your primary source of new toxins. And what have we said? All right, toxins cause oxidation. Oxidation is disease. So the more sources of toxins you have, and this is why the mouth is so horrible, because everything going on in the mouth, other than maybe a mouth and fillings, that's pure mercury, but everything else going on in the mouth is the process of toxins being generated by infections. And I don't know about the specific diabetes question, but in my book, Rapid Virus Recovery, I make personally the point that I don't think any chronic disease exists in your body unless it's already colonized, not infected, colonized by toxin-producing bacteria. And we've identified that in Alzheimer's disease and Parkinson's disease. Those things grow out the bugs. Because if you didn't have infections and new toxins in a diseased area on an ongoing basis, taking a large amount of quality antioxidants would reverse it and resolve the disease. But that doesn't happen. It doesn't happen because you're generating more new toxins on a daily basis than you're able to neutralize. And that's why the chronic disease just gradually gets worse.
That ties into biofilms too, that if they colonize, they tend to form biofilms, which protects them from the immune system. And this is why UV light therapies can help, because they help break down biofilms and allow your body's own immune system to better attack it and to control it.
And having these chronic pathogens, this is not something you're going to perceive as a sickness. It's there, but you don't know it. Okay? As Dr. Hunninghake just said, if you have new pathogens in your body, while they're freely circulating, antibiotics can kill them. But the moment they come to rest on the mucosal surface, within 24 hours, they've developed a biofilm that completely protects them from the antibiotics. And you need things like hydrogen peroxide and others to knock out those biofilms and get rid of the pathogens, because what else do they do? Is you had a cold or flu, now you feel like you're completely over? Well, unless you did something like peroxide nebulization or gargling, you have this chronic pathogen film, and what are you doing? All the time, swallowing. So every time you swallow pathogens, you swallow toxins. This is why people's guts are so screwed up, all right? Anecdotally, I've had people write me and had their son completely was cured of Crohn's disease, which is a lifelong disease, supposedly, after he started nebulizing peroxide. Another lady and her whole family with chronic black mold poisoning, completely resolved with this. That's because nearly all of our diseases come from a deranged gut. But what deranges a gut? What I just said. Swallowing the pathogens that we haven't gotten under control that are having death.
So this is the last question. We're just about out of time here. So does each body in each human need the same baseline, or can some people have different baseline requirements? And I've got an answer to this. Dr. Hoffer from Canada, who's the great orthomolecular doctor that used niacin for schizophrenia. Where he got onto niacin is there were soldiers coming back from the Second World War, where the Canadians tried to help China, and they lost the battle and were put into prison camps for long periods of time, and they were very nutritionally depleted, stressed, and everything. And when they came back to Canada, Hoffer was asked to evaluate their nutrient needs, and what he found is that the standard level of B vitamins that was normally needed for healthy people, these men needed much higher levels. So when you've been under stress, or if your food is depleted, or if you have another illness, your baseline need may be different than what the RDA says it is. And that's another reason why you need to check, because you may personally have a higher need for something than someone else that would be the standard.
The ultimate goal, of course, is a normal level of a nutrient, but one person that's not using up a lot of that nutrient due to different factors, stress, etc., won't need that much new, whereas somebody else that's consuming it very high is going to need a whole lot more. So that's a main reason for tracking the nutrient levels.
So measure. Thank you, everyone, for coming today, and I hope this was very helpful to you.